What's up everyone? It's me again, your student nurse Gigi. At kapag bago ka pa lang sa channel na to, ikaw ay welcome dito. So, panibagong araw at panibagong aral na naman ang aming ibabahagi sa inyo. Kaya ano pang hinihintay nyo? Arat na! 3, 2, 1, last week's pasok!
Good day everyone, I'm Rapunzel Grace at
I am Yolita B. Bernales.
Hello guys, my name is
Hello guys, this is Maritas Intang.
Oh, hi everyone, my name is Riljad Ampabilar.
I am Nonito Sumbong II, and we are the Group 2. And now, we are going to discuss about ABRUPTIO placenta. Without further ado, let's start our presentation.
So in this video, we are going to talk what ABRUPTIO placenta is all about, including its pathophysiology, signs and symptoms, risk factors, complications, nursing care management, and the prevention of it. So a little overview about this topic. ABRUPTIO placenta or placental abruption is an uncommon yet serious complication of pregnancy. The placenta develops in the uterus during pregnancy. It attaches to the wall of the uterus and supplies the baby with nutrients and oxygen. ABRUPTIO placenta occurs when the placenta partly or completely separates from the inner wall of the uterus before delivery. And when this happens, this can decrease or block the baby's supply of oxygen and nutrients and can cause heavy bleeding to the mother. So ABRUPTIO placenta often happens suddenly, and if it is left untreated, it endangers both mother and the baby.
Does any of you have an idea about ABRUPTIO placenta? If no, don't worry. I will explain to you why ABRUPTIO placenta happens in a pregnant woman. During pregnancy, a woman's body forms a new organ called the placenta. Placenta attaches to the inside of the mother's uterus and allows blood and nutrients to flow from the mother to the developing baby. Under abnormal circumstances, the placenta can detach from the uterine wall and bleeding can occur. This is called a placenta abruption, a very serious complication of pregnancy that carries risk of harm to both mother and baby. Because of bleeding, oxygen reaching the baby through the placenta can be reduced. If the bleeding gets worse, more of the placenta can separate from the uterus and blood may start to come out of the vagina. Blood loss can also cause the mother to become dehydrated and lower her blood pressure. This further reduces the surface of the placenta available to provide oxygen to the baby, making it even harder for the baby to get enough oxygen. Inside the baby's brain, neuron depends on the oxygen to feed them. If the oxygen supply gets too low, the neuron starts to die. If this process goes on too long, the baby will either die or be left with areas of dried or dysfunctional brain.
I will going to discuss the signs and symptoms of placental abruption. Okay, so placental abruption is most likely to occur in the last trimester of pregnancy, especially in the last few weeks before birth. Signs and symptoms of placental abruption include vaginal bleeding, although there might not be any. Next is abdominal pain. Next is back pain, uterine tenderness or rigidity. The next is uterine contraction, often coming one right after another. So, abdominal pain and back pain often begin suddenly. The amount of vaginal bleeding can vary greatly and doesn't necessarily indicate how much of the placenta has separated from the uterus. So, it is possible for the blood to become trapped inside the uterus. So, even with a severe placental abruption, there might be no visible bleeding. In some cases, placental abruption develops slowly or chronic abruption, which can cause light, intermittent vaginal bleeding. your baby might not grow and as quickly as expected, and you might have low amniotic fluid or other complication. So, seek emergency care if you have signs or symptoms of placental abruption. And that's all. Thank you.
Now I'm going to explain to you the different risk factors of abruptio placenta. So first is chronic hypertension or preeclampsia. So how does it affect during the pregnancy? Preeclampsia is maternal hypertension, which is the blood pressure arises from the normal from 180 to 180 above. So that is considered as hypertension. I can consider that 130 above. 130 to 140 is medium hypertension, and 150 to 160 and to 180 it should seek medical advice. So during hypertension, the blood goes quickly to mother and the child. And imagine niyo, malakas ang daloy ng dugo, kaya napapabilis ang circulation. Kaya dahil sa malakas na circulation ng dugo, hindi siya dahil dumaraan siya sa active facilitation of cells. Dahil sa active facilitation cells at dahil sa lakas ng daloy ng dugo, ito ay pinapalala dahil nasiseparate ng mabilis ang placenta at napaparami ang dugo. So next is drug abuse. What is drug abuse? Drug abuse is about chemical substance that is used from its normal. So how does drug abuse contribute to abruptio placenta? It also contributes because of the outer part. It contributes. Pinapalipis niya ang fluid dito sa wag ng mother. Dahil dyan, nasiseparate ang chorion sa inner, di ba dalawa nga ito, inner at outer. Nasiseparate silang dalawa, kaya dumudugo ito. Sunod na risk factor is multiple gestation. So what is multiple gestation? So ito ay consider na rin dito ang multiparity at multigravida. So it means na many times na siya nabuntis at many times siya nagbubuntis. Dahil nagko-contribute rin dyan dahil na di ba kung marami na nabuntis ang isang babae ay wala, madali na siya magkaanak. How about na lang kung during sa abruptio placenta, di ba nagiging risky ang mother kapag marami na siya ay nakakadami na siya pagpanganak. So the next risk factor is chorionitis. So what is chorionitis? Chorionitis is the infection of chorion part. Kaya chorionitis is about infection. Dito nagkaka-infection. So asan nga ba galing ang infection? Maybe ang infection ang gagaling sa labas ng vagina na nakapasok dito sa inner part. Di ba hindi na epektuhan ang baby during the infection dahil sinasagip ito ng placenta. Di ba hindi kapag magka-COVID-19 ang mother, hindi na maapektuhan ang baby sa loob ng tiyan dahil pinoprotektahan to ng placenta. During chorionitis, pinoprotektahan ng placenta ang baby. Kaya ang placenta ang naapektuhan rito at mga villi. Next risk factor is oligohydramnios. What is oligohydramnios? Oligohydramnios is excessive fluid. So that accumulates to 1,500 liters of fluid inside the chorion. And it also dahil bumibigat ang loob ng tiyan ng mother. So ganun lang po ang mga risk factor ng abruptio.
So today I am going to explain to you what are the complications of placental abruption. The placental abruption can lead to premature birth, low birth weight, fetal growth restriction, maternal blood loss, need for blood transfusion, blood clotting issues, maternal hemorrhage, fetus not getting enough oxygen, and fetal death. And the failure of the quickly deliver a baby when placental abruption occurs can cause the baby to experience severe oxygen deprivation or birth asphyxia, which can cause the birth injuries or permanent disabilities. Hypoxic ischemic encephalopathy (HIE) usually involves damage to the basal ganglia or cerebral cortex or watershed regions of the brain, but it sometimes includes preventicular leukomalacia, the neonatal encephalopathy, permanent brain damage, seizure disorders, cerebral palsy or CP, developmental delays, learning disabilities, motor disorders, and microcephaly. And that's all about what are the complications of placental abruption.
Now I'm going to give the nursing care management for abruptio placentae. So the patient needs a large gauge intravenous catheter instead for fluid replacement and oxygen by mask to limit fetal anoxia. We should also monitor the fetal heart sounds externally and record maternal vital signs every 5 to 15 minutes to establish baseline and observe progress. And keep the patient in lateral position, not in supine, because lateral position prevents pressure on the vena cava and additional interference with fetal circulation. So it is important not to disturb the injured placenta any further. Therefore, do not perform any abdominal, vaginal, or pelvic examination on a woman with diagnosed or suspected placental separation. So that's all. Thank you.
Today, I'm going to discuss about the nursing care management for abruptio placentae. So, the second nursing care management is after birth, the infant's blood will be determined from a sample of the cord blood. If it is Rh positive, the mother will receive the Rh-Ig injection. If the newborn's blood type is Rh negative, no antibodies have been formed in the mother's circulation during pregnancy and none will form. So, positive antibody injection or the Rh-Ig is necessary. So, the main purpose of Rh-Ig injection is to prevent the problems in case the baby has Rh positive blood. So, that's all guys. Thank you. Mwah!
How can we prevent placental abruption? But there is no way to prevent the placental abruption, but you can decrease the risk factors of placental abruption. And how can we decrease the risk factor of placental abruption? First, don't smoke. Smoking is very dangerous for your health and for the baby. Second is don't use illegal substance like cocaine. It's very bad for your health and for the baby. And the next one is if you have a high blood pressure, you need to talk to your healthcare provider to monitor your condition.
And if you had abdominal trauma from auto accident or fall or injury, seek immediate medical help. The next one is always wear your seat belt on any motor vehicle. And if you had placental abruption and you're planning to conceive another child, you need to talk to your healthcare provider to see and ask if there's any decrease in the risk factors of getting another placental abruption.
So that's all everyone. I hope you learned a lot from this video. Please don't forget to like, share, subscribe, and click notification bell for more updates and for more upcoming videos.